Are we watching another Omicron trend? The influence of World Health Organization, WHO, on the severity and transmission of BA.2 subtypes. With the rise in the number of Omicron subvariant BA.2 cases, are we looking at another Omicron surge in the coming days? Responding to this, World Health Organization officials said, considering how fast the variant peaked and then declined, we now have to see whether there is a slowing of decline or we will start to see an increase again. And if there is an increase in cases again, then we could see further infections of BA.2. Noting that the UN Health Agency is tracking several sublineages on Omicron, whose Maria van Kerkhove said it is incredible to see how fast the Omicron has taken over Delta, and among the sequences that are available we are seeing an increase in the number of sublineage BA.2 cases. This subvariant appears to be steadily increasing, and its prevalence has risen in South Africa, Denmark, the UK, and other countries. Watch full video here. Live QA on #COVID-19 variants of concern with @Dr. Mike Ryan and Dr. Van Kerkhove. #ask WHO https://t.co/vxisker. There are a lot of studies underway that are comparing different sublineages of Omicron, what we know about their transmissibility, severity, and impacts of vaccine. Now, among all subvariants, BA.2 is more transmissible than BA.1. However, there is no difference in terms of severity. You also pointed out that all other coronavirus variants, including Alpha, Beta, and Delta, continue to decline globally as Omicron crowds them out. Among the more than 400,000 COVID-19 virus sequences uploaded to the world's biggest virus database in the last week, more than 98% were Omicron. The UN Health Agency said late on Tuesday in its weekly report on the pandemic that just over 16 million new COVID-19 infections and about 75,000 deaths were reported worldwide last week. The Western Pacific was the only region to report a rise in new weekly cases, an increase of about 19%. Southeast Asia reported a decrease of about 37%, the biggest drop globally. The number of deaths rose by 38% in the Middle East and by about 1/3 in the Western Pacific. However, they pointed out that the decrease in the number of cases might be due to the drop in the testing rate across the globe. Health officials have noted, however, that Omicron causes milder disease than previous COVID-19 variants, and in countries with high vaccination rates, hospitalization and death rates have not increased substantially, even with Omicron spread.